Welcome to this explainer. Okay, so today we're looking at something you've probably seen a literal 100 times, but, never really paid much attention to. You walk into a clinic, check in at the front desk, flip through some random magazine from 2018, find a seat, and what's bubbling away in the corner? A fish tank, right? It turns out that aquarium isn't just some random decoration chosen out of a catalog. There's actual, measurable science behind it. We're going to break down exactly how these seemingly mundane tanks are quietly but dramatically transforming the way we experience healthcare. So, why are fish tanks everywhere in clinics? Seriously, once you start noticing them, you really do see them everywhere. It's a totally relatable question. But to understand why, we have to establish a bit of a contrast here. Just think about a clinical waiting room. By its very nature, it's an anxious space. You're sitting there, surrounded by clinical sights, sounds, smells. The visual calm of a softly lit water feature with gently swimming fish, that creates a sharp, highly intentional contrast to all that inherent anxiety. But to really appreciate this solution, we first need to completely understand the problem.
Okay, let's dive into this. Medical offices come loaded with a very specific set of built-in stressors. Basically, whenever a patient walks through the door, they're usually dealing with at least one, if not all three, of these specific hurdles. First up, there's the uncertainty about their health or the results of their visit. Second, there's the physical discomfort or even pain from whatever brought them there in the first place. And finally, you've got the ticking clock of time pressure as they just wait for their name to be called. Put them all together, and it's a perfect recipe for a super high-stress internal state. So to combat those built-in stressors, hospitals and clinics use a really clever strategy called environmental distraction. This is basically the use of aquarium-like imagery or live nature scenes to provide this calming, attention-shifting visual stimulation. And I really want to emphasize this point. These tanks aren't just an interior design afterthought. No way. Across multiple studies, they've actually been identified as evidence-backed tools deployed specifically for stress reduction. By carefully controlling what a patient sees, clinics can literally help manage how a patient feels. Now, what's really interesting about this slide is the psychological mechanism happening right beneath the surface. Researchers framed this through a process called attentional restoration. Think about it. When you sit in a waiting room, it is so incredibly easy to fall into a cycle of ruminative thoughts, right? Just obsessing over your symptoms or the upcoming procedure. But when you watch the slow, gentle, kind of unpredictable motion of fish swimming, it gently forces your focus outward. It actively interrupts that internal cycle of worry and gives your brain a chance to essentially hit the reset button and restore its attention on something peaceful. To really grasp why aquariums are the ultimate tool of choice here, think about the difference between high-demand and low-demand distractions. High-demand distractions are those highly interactive activities. Think of like a complex video game, an intricate puzzle, or even trying to read a dense magazine article. Those require active engagement and cognitive effort, which is something an anxious patient just might not have to spare. An aquarium, however, that's a zero-effort, low-demand stimulus. It's always available. You can engage when you're ready and effortlessly disengage the second you want to look away. It requires absolutely zero effort from a patient who's already feeling overwhelmed. All right, so we've covered the internal psychology of the patient and why this distraction works on a mental level. But this isn't just about patient psychology. Let's shift gears for a second and look at how these distractions impact a real-world health and daily workflow metrics. So the crucial point is how these benefits split into two completely fascinating directions. For patients, the outcomes are pretty remarkable. Exposure to visually calming natural elements is linked to lower self-reported anxiety, an improved overall mood, and, get this, reduced perceived pain. The calming stimuli actually lower the biological stress response. But what about for the staff? Well, the aesthetic improvement creates a much more welcoming atmosphere, which naturally makes patients feel like the environment is genuinely supportive. And the result? Staff experience far fewer complaints about delays. Turns out, calmer patients simply mean a much smoother workflow for everyone involved. Now, of course, you can't just, drop a bowl of water on a reception desk and expect absolute miracles. Doing it the right way requires some serious intentionality, and experts are quick to warn that these environmental tools absolutely must supplement, not replace, actual medical care protocols. To make this actually work, strict practical standards are a must. We're talking about rigorous routine maintenance and active monitoring of the water quality. Obviously, no one wants to look at a dirty fish tank. Placement is also absolutely critical. The tanks have to be positioned to avoid any potential trip hazards in high traffic areas. Plus, clinics need to carefully control the lighting to prevent glare that could end up distracting the medical staff while they're, trying to do their jobs.
let's move to and see how this builds into a broader strategy of inclusive design. Because here's an important truth. Not all patients respond the exact same way to the same stimuli. What's super calming to one person might actually feel a bit overwhelming to someone else. This is exactly why accommodating diverse preferences is so vital. Facilities should place the aquarium where it's visibly accessible, sure, but without it completely dominating the entire room. They also need to provide alternative options alongside it. Things like tucked away quiet seating, areas that utilize natural light, and other low stimulation design alternatives. At the end of the day, accessibility and choice are essential for accommodating diverse medical needs.
It really all ties together around this core thesis. Calming environmental design, including aquariums, can be a simple, low-cost enhancement to the patient experience. The healthcare industry is constantly on the hunt for effective, non-pharmacological ways to reduce patient stress. And honestly, sometimes the most effective solutions don't come in a pill. They come in the intentional, thoughtful design of the very spaces we inhabit while we're seeking care.
So I want to leave you with this final thought today. The next time you find yourself sitting in a waiting room, take a look around and ask yourself, how is this environmental design shaping my own biological stress response? Are the colors, the layout, or even those gently swimming fish in the corner actively lowering your heart rate? I guarantee once you understand the hidden science behind these spaces, you will literally never view a simple doctor's office fish tank the same way again. Thanks so much for joining me for this explainer, and keep observing the world around you.